in autistic individuals, the main thing is communication. So there's a lot of communication within the body which they are not too sure what is happening. They might be having a pain in the abdomen, but they might be, banging their ears. That is also the general gut brain. Your gut, what is happening in the gut is you are thinking that is happening in the brain. It's not that every doctor will know what to do. Do an interview of the parents, do an interview of the child, observe the child with a lot of time. Child, when he goes to a clinic, it's a foreign area for him, or an adult. What happens is that parents get so shocked that the child is behaving like that in front of a third-person doctor. They actually don't bring the child later when something really develops. It's like a cry wolf thing.
Hello, everyone, and welcome back to the India Autism Center podcast. This is your space for grounded, expert-led conversations about autism, inclusion, mental health, and everything in between. I'm your host, Sakhi Singhi, and today we're talking about a subject that's been gaining traction for a very long time in both the medical and the autism communities. This is the powerful connection between the gut health and autism. So joining us is someone who told me not to say a renowned general surgeon, but I'm still going to say it. We have Dr. Rudrajit Sinha. He is a renowned general surgeon with over 2 decades of experience, specialized in advanced laparoscopy in gastroenterology. Wow. Okay, so today we're going to explore this emerging science with him and what makes it so special to have someone with this background with us. All the more special is that Dr. Sinha is also a parent to Adhiraj. Adhiraj is a wonderful teenager. He's a non-speaking adult with autism. And he's also the vice president of Special Olympic Bharat. So today we'll be unpacking a lot, and we're going to start with autism gut health, move on from GI symptoms to dietary interventions. There's a lot for you to really explore. I really want to thank you, Dr. Sinha, for being here today. I have been hearing your name in this field for a really long time, actually, since I started off. And it's really a true pleasure to have you.
Thank you for having me here, Sakhi.
Yes.
My pleasure.
So I want to start, with the science.
Sure.
Recent studies increasingly highlight there's a link between autism and gut health.
Yes.
And can you walk us through this gut-brain axis and why it's so relevant when we talk about autism?
Yes. Again, as I said, thank you for having me here. Yes, in autism, there is an emerging kind of a link that is coming with the gut and brain. We call it the gut-brain axis. Generally, in a very layman's term, that means that sometimes some behaviors in autism is maybe due to some gut imbalance that happens, whether it is really affecting autism per se or is affecting the symptoms of autism per se is something which we will explore as we go along.
Perfect. So what are the common GI issues that you've seen in autistic individuals so far?
It depends. For example, we generally divide GI into an upper GI and a lower GI thing. Upper GI is from the intestine up to the stomach, and the lower GI is from the intestine right up to the rectum. So the upper GI symptoms would be suddenly, like a sort of a reflux, acidity, hyperacidity, or it can be some kind of a bloating, some kind of, there's some emerging signs of food intolerance, food allergy. There's a subtle difference between the two. We, in autistic individuals, we also see a lot of food selectivity. So that is also something which we are exploring right now. With the lower GI thing, lower gastro thing, which is from the intestine downwards towards the rectum, it can be come across as a bloating of the lower GI, or it can be coming as a pain that is there, and also constipation, which is also a big issue.
Is it something that is different from what you see in neurotypical patients?
So that is extremely the very, very, very good question. And it is actually, if you see in autism, in autistic individuals, the main thing is communication. Okay, if I have to go to a very basic understanding of it, they have issues in communication to their parent and to the doctor for non-speaking, non-verbal, even more so. Yeah. Also, there's a lot of communication within the body which they are not too sure what is happening. For example, they might be having a pain in the abdomen, but they might be, banging their ears because they have not very high sense of localization of the pain, which we call it. Like a neurotypical person would say that, see, I have pain on this part of the stomach, or I have pain over here. That is something they cannot do. That increases the frustration, that increases the behavior of the child or the adult, which expresses itself in something which is completely non-GI. He might be banging his head in the suddenly to saying he might be having a lot of disturbance in his daycare, or he suddenly must be tearing his hair. which we will think are banging his ear. So, for any other person, a parent might think that, maybe something's wrong with the ear. So take him to an ENT, but that doesn't get solved and the behavior increases.
Yeah.
So that is also the general gut brain. Your gut, what is happening in the gut is you are thinking that is happening in the brain. So these scars are some things which we see difference between a neurotypical and autistic individual. So once we cross that we know exactly what is happening, that actually requires, and this is something which, but it's not that every doctor will know what to do. Do an interview of the parents, do an interview of the child, observe the child with a lot of time. Maybe, with his experience, he'll get some clues about what to do, what not to do.
I'm curious about this. So, let's say you have a client whose child is autistic and non-speaking, and they're assuming that it's a GI issue.
Okay.
How do you conclude that it is?
Oh, okay, that's a great question. Okay,
Because
first and foremost,
let's say this child's non-speaking.
Yeah, so I'll tell you what is the best way to approach this is that you basically take a very detailed explanation of the parent, of what is really observing that is different for your child. Parent can tell me two things. The parent can tell me saying that he has come to me something with non-GI.
Yeah.
He's like not concentrating on his studies, or he's not sleeping. He's got sleep disturbance. And the second thing is that parents come and say that he's got constipation. Okay, suddenly he's developed constipation. So for this, what you need to do is that you need to basically observe the child take some time, keep him in a calm, try to calm him down, be a friend. So these kind of things is very important because child, when he goes to a clinic, it's a foreign area for him, or an adult. So that might bring in more behaviors, and that might, make the entire experience very stressful for the child and for the parents. What happens is that parents get so shocked that the child is behaving like that in front of a third-person doctor, they actually don't bring the child later when something really develops. It's like a cry wolf thing. Okay, so that delays the diagnosis. Now, despite that, what we do is that we try to observe what is happening, do some initial tests. If I see that it is a, abdominal thing, maybe I'll order for some blood tests or some scan, very initial way. And then I'll give them some kind of a pain relief kind of a thing, if it is really pain relief or a constipation, they're saying. And all these things should be kept in mind that the child use it for a short period of time. So what happens we see in our practice is that when parents go to different doctors and come to me, I see that they're already having 10 medications and what to give over there. So this is actually something which we all need to work on.
And you mentioned blood test.
Yeah.
And it's not easy to get blood
Oh
tests.
my God, don't tell me that. That is absolutely important. Adhiraj, poor guy, he had a root canal thing. So first and foremost, the dentist, and she's a very good dentist, told me that you attempted 6 times, we could not do it, so you need the general anesthesia. Okay, so the entire thing got delayed and the poor guy was in pain with the root canal thing. And then for general anesthesia, you need some pre-anesthetic blood tests.
Yeah.
So that again took a further 2 weeks to do. So that actually he had lived with it was just after COVID. So he actually have the lived experience of a parent and as a doctor that I'm not being able to do a simple blood test. So I can do the operation and relieve my child of the pain. So this is something which all the
How did you manage that? How did you
so it was so he was always 14, so he's already big. Okay, so you cannot really push him down and do it. So we actually had 3-4 people hold him down and take the blood. So surprisingly, after we took the blood, then the entire operation was very smooth.
Okay.
Because he understood that this for thing, and then it got healed very, very, very well. But the entire the delay in treatment happened because of a non-medical reason. Is that the person was not giving blood or cannot tolerate local anesthesia. It's very traumatic for any autistic person to sit in a dental chair and open his mouth and sharps going inside his mouth. It's traumatic. Yeah. They will never let you do it.
Yeah.
So see, these are the things which we have to work on with the autistic population, with our health infrastructure over here, make them more sensitized towards how to engage with an autistic individual.
Which actually kind of ties into my next question. Yeah. Do you recommend, let's say there's a parent of a child who has not consulted a GI doctor, is that something that you recommend that parents should do? Okay, so one thing which I would like to really take this opportunity and tell every parent over here is that, make sure that you have one doctor, a family doctor, who knows your child, because his insight is very invaluable.
So what happens is that when you go to a GI specialist, or you go to any, say, orthopedician or a gynecologist for autistic women,
Correct.
What happens is that specialist, he only sees him or her only for, say, 15, 20, 30 minutes,
True.
which is, they are also under a lot of pressure with a lot of other parents. So what happens is that what I tell them, all my, other people who consult me, is that have a family physician who's seen your child, or who's seen your child growing up, or you go regularly to him for this thing. It is a huge thing for that specialist to have a telephonic conversation with that person concerned and say that, I'm getting this finding, and just exchange notes. These are very small things to do.
I don't think that happens anymore. I think everyone's going doctor shopping now. Everyone is going from one doctor to another. I know that my parents had one family doctor.
Yeah.
I have, for any symptom, I go to one doctor for once and then another doctor for another time. And I think that's really helpful insight to give to.
Yeah, it is actually very important, because you'll have to see that, a lot of things get lost in translation, because what the autistic child or person tries to convey, as it is not being able to convey what is the parent understanding. That's a great barrier, communication barrier itself. The parent and the doctor, like the doctor with the layman, there's a communication barrier over there also. And that is why the layman goes doctor shopping.
Yeah.
So this is actually a very vicious cycle that happens. Yeah. So we, have to change that. So that can only come with, if we have good intermediaries who can understand both and try to get it together.
So back to the question, in your expertise, in your clinical expertise, how often have you seen these GI issues get overlooked, misunderstood, and especially in the cases of non-speaking individuals?
So first and foremost, you will absolutely notice that they come in late. Yeah. Okay. So the first, if anything happens with a GI or any kind of, it's a lot of hidden things that happen, which unless you go to a doctor and examines, you cannot find out. Okay. So if I, for example, encounter a patient who has come to me with a sudden change in behavior, with the family thinks it's a GI issue. Okay. So I'm not going to see any sign in the GI and examination who's going to tell me that it's a GI issue. So I say that, are you sure it's not an ear infection, it's not a dental issue, or it's not a urinary tract infection? These are hidden things which can bother the child.
Yeah.
Okay. So this is something, awareness, which the doctor should have, and mostly the parent should have as well. Okay.
True.
So that is something which the parents should know. Second is that if I see that and invariably for a parent to understand that there's a GI issue or any issue, because the parent doesn't have a communication, doesn't understand this communication, just sees a change in behavior maybe, suddenly he's become aggressive or whatever. So they say that, okay, let us talk to the special educator, let us talk to his school, let us talk. So this actually takes away a lot of days. Actually, the first awareness thing has to be done with the parent. The parent should know that, these are the hidden places which I'll have to see whether there's an issue or not. Second is that we have to, if we see that is not, I'm not being able to solve with any kind of painkiller or something, take him to a doctor then and there. Okay. Let him have a look. Minimum, you do a scan, an ultra scan, to see any kind of, inflammation is happening in the tummy or not. It can be an appendicitis. It can be this thing. So, and give an initial treatment, see how it goes.
Okay.
So medical line is also giving an initial treatment, see how it goes, and then do a further test. So it always, this step ladder pattern it goes to. So this initiation of step ladder pattern is something which gets delayed in autism.
Yeah.
Yeah.
Mainly because you think there is so many communication lapses.
It is. Can I give you an example for this?
Yes, please.
So the example would be, this happened 2-3 months ago. Actually, special educator gave me a call and saying that, there's a child who's got an operation done. So, but his operation is, his car is not healing. He's again having this same problem. So I said that, what is the operation for? So he said, I don't know, send me the papers. In the papers, I found that he had an appendicitis. Okay. And he had a pain, which the parents could not understand that pain was over there, and the appendix burst. Okay. So what happened in a one day next day discharge kind of scenario? It went to 10 days of hospital. So that is what I'm talking to you about. So it is not anyone's fault. It is just the situation that is, a parent has to be very aware of this is what is happening. Get to a general physician, get to a GP. So I told you this role of a GP or a family physician is absolutely critical over here.
Yeah.
If before you go to, just have a GP who knows the child, who's seen the child grow up. This actually is a life-saving kind of a scenario.
How can parents know that something is up?
So what we tell for everything is that first and foremost, some behavior will change. If it's a gastro issue, some behavior will change. You will see that whether the is waking up from sleep or not, the sleep is disturbed, not being able to concentrate. There is now, the sudden change in behavior, little aggressive, little more meltdowns. So these are actually not defined guideline-oriented things because we are still trying to know the science. But what we have to know is that parents to be very aware of it. Whatever you do, even if it is something which you feel that no, it's just a behavior, will be okay.
Yeah.
Just have that family physician or someone who you know, or your friend doctor you know.
Correct.
Be friends to doctors. It is good. It is very helpful. So once we do that, then you will have very good results as you go along. So parents have to be very aware of that and make sure that sometimes, you might have to do a scan. Now, getting a autistic individual to do a scan, that is also very difficult. So there's also thumbs where we have to go.
Yeah.
So this you have to be very aware of what.
Are you a fan of these wearables? To track sleep and all of that.
See,
what do you think of that?
So is this I'm going to answer this. See, the more you know about your vitals, the more worried you will be in life.
I totally agree with you. I know someone.
Yeah.
And that someone is my fiance, used to keep checking his heart rate and get scared.
Yeah.
And eventually he threw his watch because he was like, I keep getting panicky about it.
Yeah. You should not. I am like, maybe I've become too old for this, but I don't think wearables really help beyond the point.
Yeah.
Because if you are constantly knowing because we are constantly, in the morning we'll have different heart rate, evening we'll have different heart rate, and you base your entire life because of that. Like, it's like checking weight. You do some exercise, you lose 0.5 kgs, and then again you go, and then you don't lose 0.5 kgs, and oh my God, I'm doing the wrong thing, and then you completely lose the motivation to do anything.
That's the story of my life.
That's the story in everyone's life.
So there's actually there's this growing discourse about this gut inflammation, microbiome imbalance that influences mood and behavior. Yeah. So much so that I see it every other day on Instagram. Okay, inflammation, drink cinnamon, drink this, drink that. Sure. Could you share what the medical literature and your personal experience suggest on this front?
So our gut has there's a good bacteria and bad bacteria. Throughout our evolution, there's some bacteria which is inside our body, which is actually symbiotic with us. Okay. They only live in our bodies. They cannot survive elsewhere. And we have a symbiotic relations with them because they help us digest some certain foods. Okay. And this is what we call our microbiome. Okay, there are a lot of bacteria over there. Okay, and different bacteria, everything over there. So what happens is that, and they have in our gut, it's like a long road, and they have some are in our mouth, some are in our upper intestine, most are in our lower intestine. So what happens over the course of time, we see that sometimes when we are stressed, sometimes when we have a lot of different foods, or sometimes even if you go to a different geographical location, our gut bacteria, those kind of things changes, the species changes. So once it changes, what happens is that we have bloating, we have different GI symptoms that comes. We tend to put on more weight. We have more hunger cravings. So all these things, you can say that gut-brain axis working, maybe. Yeah. So that is what is happening. So sometimes what happens is that that is one part of it. So, and sometimes these gut bacteria also, since it is also protects you in a way that it gives certain amount of immunity. So once when we have food which does not really agree with us, there's a ye khana humko acha nahi lagta hai. But entire family is having. It's that. Sometimes what happens is that your gut bacteria, they actually it treats them as foreign objects. So the first reaction to the body to treating a foreign object is inflammation. Okay. So the concept of meta-inflammation is coming because it not only our gut lining, even our heart linings, that early heart attacks, all these things are emerging. We are understanding that right now. So we can say man is not an island, is actually a group. We are symbiotic to a whole host of microbes. So now what happens is that with the gut brain is that we find that sometimes when we are having bloating, I told you, we have bloating, you have very bad mood into a work day. Yeah. You feel more stressed. Yeah. Sometimes when you're not cleared in the morning in the toilet, you feel absolutely stressed. Some
bloating is psychological also?
No, not necessarily. see, sometimes this what happens is that our entire gut becomes very sensitive. Okay, so if some kind of air is there in particular in the gut, you will feel that no, I'm feeling very bloated. Okay,
yeah.
There is no tests for that. For bloating, you'll find like that, but definitely the test, a plain X-ray will show you whether the intestine is
bloated or not.
Caliber is more or not. But what happens is that since we are absolutely connected, before we had brains, we had guts, evolutionarily. Okay, so our gut is seen as a second brain or a primitive brain. Okay, though it gives us slow signals, not as quick as the brain, but it gives us signals nevertheless. So as not only for autism, but also neurotypical, for everyone, you will have to really take care of your gut.
Gut inflammation and microbiome imbalance is definitely something that changes the
definitely.
And behavior.
Imbalance, I'll tell you what microbiome imbalance is. Sometimes, our gut bacteria, which is there in a particular part of the gut, it goes to another part of the gut.
Okay.
Sometimes the species bad bacteria mixes up with them, and there's a fight inside between the good and the bad. So in a very layman's terms, that is what it is. A simple course of probiotic or a gut cleansing will help you go a long way to help you with that. But it is not that you have it for 6 months, 1 year.
Oh, nothing too crazy. Just
nothing too crazy. Just
I don't
the course
think
would do.
And now I come to this grand question. I don't think any conversation about autism and gut health can happen without mentioning the GFCF diet. One of the most widely discussed diets. From your standpoints, how effective are these elimination diets, doctor?
So I'll tell you a few things about diet. See, all the diets is not something which is autism specific. If we take the GFCF diet, we have found that some people, not only autistic population, with neurotypical also, they have some sensitivity towards gluten. Okay, it's something which you get in wheat. And when you elimination means that remove that particular thing off from your diet, suddenly you become okay. Okay, so this is something which is medically there are some diseases which causes this, right?
Okay.
Not to say that autism will have more of it, but elimination diet or any kind of diet, always you have to be the caveat that there's some kind of essential nutrient that your body is not getting. And it's especially so when in a preteen or a teen, when the boy or the girl is growing. So you'll have to be very careful. All these diets can be attempted, but it can only be attempted when it's medically, know that it is there, and it always has to do through supervision, either through a medical doctor or a dietitian.
Got it.
It is always through supervision, and it should not be for a long duration of time.
Got it. I have a question that could actually be just a personal question, but I'm guessing people can benefit out of it. So food, you started the conversation and you were talking about food and sensitivities are different from that of allergies. I've noticed this, that in America, okay, everything is like a peanut allergy, this allergy, that allergy. I don't see much of that here. Is it just because we just shove it under the carpet, or do you have like a take on this? You
have to understand one thing. There's two aspects to this. Okay, most of the scientific literature that we follow are basically for research done on the Western population. That includes lactose intolerance and gluten sensitive diets.
Right.
Okay.
Yeah.
They are maybe genetically more susceptible to these things. We are less susceptible to these things. Also, as we grow, we see that both of our generations, like you can see your generation and my generation, one ahead, but before, we are the first generation which actually got exposed to Western food.
That's true, yeah.
Okay. Our grandparents
did not.
They did not, and they had robust gut health.
Yeah.
Okay, so you will have to, the learning from there is something we'll have to say that if we have to go back to the diet, because genetically we are like our grandparents and before them, we have to go back to the diet which our grandparents used to eat. So normally in my practice, when anyone comes with bloating, before anything, and I'll give you a tip, I tell them you remember when you were young and your grandmother used to cook, what she used to cook. You say, well, I used to cook all these things. Have that and see. So you have that for 1 month, believe me, all of this goes away. Now, coming back to your question, where you see that peanut butter allergy and food sensitivities and all, it's very important that you answer this, because a lot of our allergy is based on what our genetic makeup is. Okay, and something is environmental, right? So without going into specifics of it, maybe they are more sensitive to a certain amount of foods. Indians are more sensitive to certain amounts of food. Okay, now between a food allergy and a food intolerance, there's a subtle difference. Like in allergies, it means that even a small amount of food you'll come with rashes and sweating and all these things. But intolerance would be you'll have your discomfort will increase with the amount of thing that you have.
Correct.
So a lot of people have lactose intolerance. So more lactose you have, the more squeezy you'll feel.
Yeah.
You'll have one glass of milk, it's okay. But if I have glass of milk,
tub of ice cream.
A tub of ice cream is going to cause. But allergy is that even if you have a bite of that prawn and then you come out with hives and rashes, that is a medical emergency. If it doesn't happen to you, go to a doctor immediately. Okay, immediately. Not like I'll go tomorrow morning.
So you mentioned the genetic makeup is the reason why these allergies happen.
Sometimes genetic and environmental.
And environmental. Doctor, I have seen all of these kits, which is like stool sample, send us your stool sample, we'll tell you what your gut microbiome is like, what foods suit you, what nutritional amendments you need to make. What is your take on that?
My take on that is that it's like emerging area of work that is coming.
Okay.
See, the best sample of what your microbiome is, what is coming out.
Right.
Okay. So if you do tests on that, we'll give you the entire, it's like a micropack fingerprinting that you have.
Right.
You can actually make out that this comes from this part of family or this comes in this geographical area, this stool sample, because that is a microbiome present over there. So saying that, this is an emerging science. This is something which is still not very specific. Maybe it will be another 5 to 10 years when, whenever some kind of a new thing comes, it comes in a very non-specific thing. It just shows a direction, but maybe we're moving towards in which every individual people will have a diet chart. This is what you have to have now. We're moving towards that.
I do agree with you on that. So before we wrap up, I have a couple of questions.
Sure.
These are common myths about autism and gut health that we found. These are actually kind of most Googled. And you can answer true or false, or you can say a statement if it's somewhere in between.
Go for it.
So GI issues in autistic individuals are usually caused by their behavioral habits, not physical conditions.
Okay. So this is a true and a false, both, because there's two parts to this, is that what I would advise all parents to do is that know your child, keep a food diary. You see what is really affecting him, is not affecting him. If you know that previously this thing caused constipation, then don't give that food. Okay, you see how it is, right? Also, take it out from your mind that, autistic has different GI issues. It is not. They're absolutely like us only.
Yeah.
Okay, so
so it's okay. Wow. Okay. Yeah.
So it is absolutely like, no, that is something which you have to put in your mind first. Okay.
Right.
So once we do that, then if you see that, no, the child is having this persisting for more than 12 or 24 hours or 48 hours, some change of behavior has happened. Normally for gut is such a sensitive thing, it actually affects our own, all neurotypical behavior. Okay.
That's true.
So rather than moving thinking that my autism is causing this gut issue, try to go towards the gut issue might cause some behaviors, which is come new, like something which has changed from his normal behavior.
Got it.
You have to go towards that.
Understood. Thank you for that, doctor. The second one that I have is probiotics can de-escalate symptoms of autism if taken regularly.
What do you mean by symptoms of autism?
Things like, maybe communication can get better.
No, that's a myth.
Okay. So food sensitivities in autism can only be diagnosed with blood tests.
No. Food sensitivities, not all blood tests will show you a food sensitivity. You can have stool tests as well. You can have, if there's something in which maybe just simple, if you give this food, the parent will tell you his behavior changes, he gets vomiting tendencies. That is also a sort of a food. No.
Not just blood tests.
It is something which is actually still not developed as yet as much, but we are moving towards that because everyone tries to move towards, science moves towards through tests and what we get it.
Got it. The fourth question I have is, children on the autism spectrum often benefit from structured diets, but still need dietary flexibility. Okay,
so this is a very important question. This is actually a very big answer for this. You have to understand children in autism spectrum has a few certain things which you're beginning to understand this. First is food selectivity. Okay, they only like a certain type of food, certain color of food, because they can predict the taste of that food. Okay, like for example, you find your child will be very happy with food that comes in packets.
Yeah.
Because they know that all these packets will
Taste.
Which tastes the same.
Same.
Packet with this color will taste the same. So they have fixated on that. It is not that they don't want to try it. It is just that they have anxiety over trying a
What's
new
gonna
thing.
come up.
What's going to happen? They're very sensitive all around. So as a parent, you'll have to understand that and take a very holistic view over there. If you see that your child is fixated on one food, try to slowly train him to, we call it a food chaining. Like you have the same, if you find that child is going for same color, like for example, a lot of child don't have fruits,
Yeah.
right? You try and have some salty equivalent, and then you try another salty equivalent with the same color or with the same texture. Then only you can explore other foods.
Other food options.
Right, that's very important. Food selectivity is important, and then of course there is something called meal time. Meal time has to be a little bit structured. You'll find a lot of children don't like to eat outside.
Yeah.
But the thing is that too much structure also causes a problem. You'll have to be you have to be structured, or you should know your child.
Yeah.
Like every child is different.
True.
You have to know your child. If he's okay with this structure, if he's not having outside, with that, you not reproduce that thing in your friend's place or in your relative's place. You make the person understand that he needs this kind of lighting or setting to do that.
Understood.
But don't get too much obsessing over that. Then your child will not be able to. The child have to know.
What's your take on almost forcing the child to eat?
No, never force your child to eat. Never force your child to eat. So there is a few things which you have to know. There's a particular thing which is just about coming called ARFID, is avoidant and restrictive intake of food, which is a very serious condition with children, especially in neurodiverse children.
Is it an eating disorder?
It is an eating disorder.
Okay.
It is an eating disorder which is scientifically proven causing nutritional deficiencies. Okay. So that is something which you need to diagnose, and there are certain criteria for it. There's actually a very big this thing for it. Like for example, I'll just write in short. For example, the food should be, it has that, he has a, through blood test, that he's having a sort of a nutritional deficiency. Okay. The parents say that he only has this kind of food.
Right.
And that is causing that. It is not due to non-availability of food. In a lot of geography, this food is not available. It's not that. Those are some guidelines is that. So your gastroenterologist or your dietitian will know about ARFID8. So you have to rule out that. That also has got to do with some behavior therapy. Got to do with
some counseling.
Cognizing, you have to do counseling. You'll have to food chaining. You'll have to, this takes 3 to 4 months. It's not exactly a medicine kind of treatment. A lot of psychotherapy also comes in, but this is the serious part of the eating disorder. So
force feeding is never don't force your child to eat.
No. Previously our parents used to, you have it.
Yeah.
This is something which has changed over the course of time. A child wants to eat, they will eat. Okay. Maybe if you want the child, for example, there are few steps which you do for behavior therapy. Like for example, if you want to make the child curious about the food. Okay. First put a particular new food next to him. Okay. Observe for 1 week whether they're seeing them or not. Then the child will one day allow him to touch it. Okay, then you touch it and put it in his tongue. So this is a course of 2 to 3 to 4 weeks, and you will see that you can introduce new food, nutritious food, and give a balanced diet to your child.
Got it. My last question is, treating gut issues may help with sleep, focus, and even anxiety in autistic individuals, isn't it?
It's true for all of us, but even autistic, even more so, because they cannot communicate.
Yeah.
Okay, that actually aggravates everything. And remember, a gut health, if you have to say a last line to it, a few things are very important autistic, is that the child or adult should have adequate exercise. It's very important. Our children do not have adequate exercise because they don't have a playground to go to. They're socially isolated. So these are things your child has to be, especially a growing child, a teen, has to be physically drained. Okay. The sleep is also very important.
Yeah.
The sleep gives a pointer whether the gut health is good or not. If the child wakes up or having disturbed sleep, you have to think that there's something wrong with the gut. Okay, maybe he's having diet. Third is there's also, socially, we have so much ads for fast food and everything. That has to stop. You have to, that is also, your food, fast food is so easily available. Often parents get tired. I'm like, I don't want to cook. So let us just order. So these kind of things over the course of time, once in a while, everyone wants to have a party and go. That's fine. But, it should not be a routine kind of a thing. Just go back to what we used to have, our lives, food habits were there 50 years when we were young.
Yeah.
and a child autistic, just go and try to replicate that in your family. You'll find most of the symptoms go away.
You make it so simple, and I absolutely love that. And thank you so much for sharing your time and expertise with us, Dr. Sinha. This podcast has really helped us clarify some of the most pressing questions that parents have.
Sure.
And it's actually a privilege to hear directly from you.
Thank you. It's my pleasure as well.
Thank you. So to all our listeners, if this episode has helped you, please do like, share and subscribe. I never get tired of saying that. It helps us go a really long way to get experts like Dr. Sinha in front of us to answer questions that you have had. So thank you so much for tuning in. And until next time, do think of clicking on any of the videos that are popping up in your screen. And also, if you have questions for Dr. Sinha, please do leave it in the comments below. We hope to get them answered by him. Thank you so much.